Hello and welcome to the Virginia Suicide Prevention Month opening webinar. My name is Sarah BAZEMORE. I'm the School Counseling Specialist in the Office of Student Services at the Virginia Department of Ed. And I am joined by two of my colleagues, Christine and Martha. Christine, do you want to say hi?
Welcome everyone to week one of our webinar. My name is Christine Stone. I am the School Mental Health Grant Project Manager here at Office of Student Services at VDOE.
And hi, everyone. I'm Martha Montgomery. I'm the School Psychology Specialist in the Office of Student Services at the Department of Education. And in this effort to promote suicide prevention, we have collaborated with a number of partners across the state, not only other state agencies, but our colleagues in our state organizations have worked towards this effort in a collaboration, and we really are excited to promote suicide prevention as a collaborative effort across the state.
As experts in mental health, I don't need to tell you the need for suicide prevention. I also probably don't need to tell you that that need is now greater than it ever has been before. We know that so many of our students have suffered trauma and are coming back to school with new struggles. They may now be presenting with new behaviors, and they might now have mental health needs that they didn't have prior to the pandemic. We also lost some students to suicide over the last several months. And so sometimes while those losses might have occurred several months ago, when our students are returning to school, we know that those feelings of grief and loss and all of the things that are associated with that may resurface. So this work is always important, but it's even more important as we return to school this school year. So we are excited to put forth some resources, some suggestions, and just to bring this topic to the forefront of everyone's mind. We know that suicide prevention is an ongoing effort, but we use this month to highlight the importance of it, promoting self-care, remembering those that we have lost, and just continuing to do all we can to prevent suicide.
Our webinar series follows the national campaign and uses the same themes. So in week one, which will follow this introduction, we will feature Be the One to Ask. Week two will be the One to Keep Them Safe. Week three is Be the One to Be There. Week four is Be the One to Help Them Connect. And week five is Be the One to Follow Up. So we look forward to bringing you those webinars each week in September.
In addition to those webinars, we have resources that complement and align with each of those themes, and you can see those in the newsletter that was just shared. But additionally, we have a Padlet that has a lot of resources, those featured in the newsletter, as well as additional ones that we hope will be helpful as you're looking for ideas and strategies for supporting this effort. Additionally, we have our weekly webinars, as Martha shared, and we have our first weekly webinar following this introduction, where we're going to be partnering with some of our stakeholders. So in the following webinars, it won't just be folks from the Virginia Department of Ed, but we will have some folks from the groups that you saw listed on the previous screen, as well as a parent that is going to help us with these presentations. So you're going to be hearing from other folks as well. And those weekly webinars will be short and brief, really with the opportunity for us to share resources, strategies, and tips that are aligned with those themes that Martha just went over. In order to receive and have access to the following webinars, you'll have to register, so make sure that you do that. The link to register was in the newsletter that was sent to you. It's also embedded in the slide deck that you'll have access to as well. So we hope that you will register so that you can receive those webinars weekly throughout the month right in your inbox.
Also, we are going to send out some tweets, so please do look out for that, some social media tweets, and follow that hashtag, like Martha said, Be the One VA. And each week we'll have the hashtag of the theme of the week. And what you can expect are the tips and resources and some engagement activities and questions. So we do challenge each staff, each school division to do at least one thing each week within the theme to support suicide prevention in September. Share it with us again via tweet, and we'd love to hear from everyone and seeing what everyone is doing. That ends our introduction within this webinar. And for week one, what we look forward to is in this webinar discussing destigmatizing mental health. So we'll talk about that today. Also give you guys some information on strategies to do within each individual school and how you can ask certain questions and really do attentively listen when talking about suicide with students.
All right, so let's jump right in. So we know that a big piece of suicide prevention is this destigmatization of mental health. And that is something that occurs by normalizing it, making it as normal as going to the doctor, right? I really love this image that we have on this slide. It's by the American Suicide Prevention Association, and they have a lot of really great images that you can use. But I think this one is just a really powerful one. But this involves everyone, and we can't normalize mental health unless we build awareness, but then also engagement opportunities. So we can't just talk at our students or talk at our staff or talk at our community. We have to also engage in discussions and offer them opportunities to talk and to lift up their voices. So that's a really important piece of this work. So student awareness, we know that this can come in a lot of different forms and a lot of different methods, and a lot of schools are already doing some incredible work around this. We wanted to show you some resources that are our favorites. The partner toolkit, it's from an organization called Seize the Awkward, which I think is a fantastic way of talking about how sometimes it can be awkward, but we need to push through that. Has a great toolkit for engaging students and ways that you can get them involved. The Mental Health Commission of Canada, I really like this toolkit because it's brief and it has some really cool concrete activities that you can do with clubs or groups of students to engage them and also build awareness in the school community. And then Erica's Lighthouse, and this one I'm actually going to pull over and show you really quickly, because while all of these resources are fantastic, Erica's Lighthouse is phenomenal because not only does it have ways that you can engage students, but it also has family engagement as well as classroom education resources. And these are all available for free. So I encourage you to check this out as well, because there's just so much great information here that is worth taking a look at, as are the other ones. So let me go back to our resource slide here. I apologize. Here we go. And so one of the ideas that I came across that I thought was really, well, I also want to point out, I'm sorry, for staff awareness and engagement, we know that these are two great school resources. Classroom Wise is a mental health literacy curriculum that is rich in resources. It has a fantastic modules that you can have staff participate in. There's 3 of them. There's a resource library. There's ideas for bulletin boards. Like this is, I can't say enough about how fantastic this resource is. And then Transforming Education, they have an adult SEL toolkit that is incredible as well and has a lot of great strategies and tips for engaging staff in self-care as well as relationship building with students. So I encourage you to check that out as well for some techniques or tips that you might want to use with your staff. But then when we think about community awareness and engagement, again, there's a lot of resources that are come out of Erica's Lighthouse, but also sometimes it's finding targeted resources for certain family members, or having those resources readily available for when you know that a family needs something specific, or even just sharing out articles or resources regularly with staff or with your community around relevant topics. And so the Newport Academy and Child Mind are 2 of my favorites that have parent-friendly articles, videos around mental health topics that you can easily share in a targeted way or just broadly, so that parents realize or families realize that these resources are available from the school setting. Additionally, a really cool idea that you might want to consider is hosting a mental health services awareness night where you invite mental health service providers from the community to come, maybe set up a booth and engage with the staff and the students and the families around what they can provide and what services are out there. And then also your school-based mental health folks can also have a booth so that families can learn about the services that are provided in the school setting as well. And then I love a good bulletin board, and I think these are just some really cool ways to change the environment and to bring that mental health awareness and destigmatization really to the forefront of the school. And so these are just some cool ideas that I found. Toilet Talk, if you're not familiar, is just finding flyers or information that you can put on the inside of this stall. And so maybe you could change, maybe it could be a self-care strategy that you promote and you change those signs out every month, or maybe it's painting the stalls like you see that these students did. But I thought that was just a creative way of promoting mental health awareness. And then I have some more bulletin board ideas here. And I think when we think about bulletin boards, you know, it's really neat because you can use a bulletin board or a wall display to do so many things. You can provide resources, you can encourage help-seeking behaviors, you can promote self-care, or it can just be to destigmatize and build awareness. And I think by posting something like this depression one, for an example, that's a huge piece of normalizing things, putting it out there for everyone to see and saying like, this is okay for us to talk about. And this is a safe place for us to do that.
Thank you, Sarah, for that. Definitely some great strategies and resources to really normalizing mental health. Just as much as we take care of ourselves physically and we go see our doctor and things in that nature where we're not feeling well, definitely to normalize prioritizing your mental health definitely takes precedence. So thank you for that. This next slide has a really awesome 10 tips for asking the question and also listening. Tips for asking, leaning in, knowing your resources, again, listed here, and also tips for listening. And this slide is an easy handout for staff as well. How to ask someone about suicide. This blog post actually was by NAMI, National Alliance of Mental Illness. Again, an excellent resource for gatekeepers. Includes tips on starting the conversation, asking that suicide question, and what to do specifically after asking. Also, another great resource down below is the Suicide Thoughts and Behaviors Guidelines. These guidelines provides information in a digestible format that's also easy to reference. It includes helping people who are thinking about suicide, also covers signs a person might be suicidal, how to approach that person, how to talk to them, how to assess the urgency of the situation, how to keep them safe, what to do if a person has acted on those actual suicide thoughts, and how to deal with confidentiality issues. Again, what we've done here is there's a link for handouts for staff that it's easily accessible. They can put it in their own space. You can easily review it. We thought it was a really good resource.
Yeah, and I think that's just such an important point about we need to make sure that we know how to ask the question, but also do our staff know, and do they feel comfortable, and do they have the toolkits? Because sometimes they're the ones in those organic moments where the student opens up to them and they need to be prepared and able to respond. So thank you so much, Christine, for highlighting that.
Thank you, Sarah. Yes, that's absolutely true, because everybody in the school community is a gatekeeper. And we know that students are going to connect with those that they have a relationship with. And sometimes that's a bus driver. Sometimes it's a cafeteria worker. Sometimes it's an assistant principal. And so we really want everybody in the school community to be aware of what to do if a student does come to them, or they're faced with some information that might prompt them to believe that the student might be at suicidal risk. So we do know that in legislation in Virginia, all schools are required to provide a suicide prevention awareness training as an annual piece of training for your staff. So think about how your staff is trained. What about students training? Because we also know that students carry a lot of that information with them as well too. And if our students are trained, then maybe if they're aware of a situation, then they can identify who they need to go to help a friend. So, and then think about, we also don't want our gatekeeper trainings and prevention efforts to be just a one-time a year event. Think about how you can intentionally embed practices throughout the year to promote prevention and reinforce these skills throughout the year. We would invite you to look at our suicide prevention training for school staff webinars that we have created. They do satisfy the requirement for the suicide awareness training. I would also recommend that if you are to share these with your staffs, that you also have a follow-up conversation about what this looks like in your school building. To help the staff become very comfortable with what they need to do if they're in a situation that maybe they're uncomfortable with. For additional resources as well, we do have a suicide prevention webpage at the Virginia Department of Education. So I'd encourage you to look at that, find some additional resources. We have printable handouts that you can use for a variety of situations. And then there is also a link to the trainings to recognize and respond to student risk. So thank you for joining us. Sarah, did you want to add something?
No, I think that was great. Thank you so much, Martha. I think I really like what you said about is thinking about ways right now that you can intentionally embed some of this work throughout the school year. I think that's just such an important thing that it can't be isolated to just this month.
Right. Absolutely. We want to keep our kiddos safe. And the more we talk about, the destigmatizing efforts, that could be a way to keep things going throughout the year. So there are lots of great resources and ideas. It doesn't have to be trainings going on throughout the year. It could be, but it could also be a lot of different creative methods or strategies in order to promote prevention. So we know you guys have great ideas out there, so we look forward to seeing them.
Thanks everyone so much. And I hope that you register so that you can receive week 2, week 3, and week 4 of our webinar series.
Wonderful. Thank you, everyone.
Thanks, everyone.